14 days of an upward trend. So we're not where many of our neighboring states are. They have huge spikes, but we are also not as successful as we'd like to be in leveling transmission. You know, down a little, up a little, down a little, up a little is what realistically we could see. I mean, we wish we could wipe the virus off the face of the planet, but maintaining it would allow us to move forward and continue to function, and schools will be reasonably safe. It means that we have an R0 value of around 1. You know, 1 week it could be 1 of 0.05, another week 0.95. But if it sustains being above 1, and it looks like that's where we've been the last week or so, that means it'll grow over time. And it's not a matter of if, it's just a question of when it gets to the point where we have widespread community transmission in our state, and that everyday activities become more dangerous. So we really need to make sure that we don't reach that point. We don't want to have the kind of setback that Arizona or Texas is having, or Utah or Oklahoma. We don't want that kind of setback on the health side, loss of life, you know, tragic situations for families. We also don't want to have that kind of setback on the economic side with additional closures. So, you know, a couple things we need to do to be safe and prevent that from happening here. One is something that we've been doing very well, and that's wearing masks. And other states are just catching on, which is also good for us because some of the people who've come from those states here have been the visitors who haven't been wearing masks. So hopefully if they're wearing them at home in Arizona and Texas, which they are now, they're much more likely to be wearing them when they visit Colorado, which is our way of doing things here. We've have very good mask wearing. Doesn't mean everybody all the time. I always get people on Facebook saying, I was at the grocery store and 3 people weren't wearing masks. Well, you know, that can happen. What's important from first of all, from an individual perspective, yes, it's stupid not to wear a mask. You should wear a mask. Protect yourself, protect others. From a public health perspective, we're looking for, you know, 80%, 85% wearing masks. We're happy. So that means there's going to be some people that don't want to wear it, you know, and don't agree with that decision. You know, I don't agree. What was it in you know, people make all sorts of poorly informed decisions. But from a public health perspective, we'd love to be at that 80-85% mask wearing. I think we're there today. We need to keep it up. We need to grow it. I think there's been a big breakthrough in mask wearing for a while. It unfortunately, like too many things across society, almost seem to become like an ideological thing or even like a party thing. But I think there's been a breakthrough now because you have Mike Pence wearing a mask. You have the governor of Texas and Arizona saying everybody needs to wear a mask. These are staunch conservative Republicans. This is not a ideological or partisan thing. It's a science thing. The virus is the virus. The virus is objective. It exists. Wearing masks protects you. And by the way, the other piece, in addition to breaking through some of that ideological stuff, there's just been so much more evidence, scientific evidence in the last few weeks that wearing masks are beneficial. By the way, not only in preventing you from spreading it to others, but also offering some degree of protection for yourself. And Dr. Birx mentioned that the other day in her remarks in Arizona, saying this protects not just others for yourself. But that was something the scientific community wasn't really ready to say a month or two ago when we started wearing masks in Colorado. It's now gotten to the point with all the evidence showing mask wearing works. Please, you know, whether it's a requirement in your town or not, in your county in Colorado or not, wear a mask. It's the most simple thing you can do. The other thing we need to do is be smart as we celebrate our nation's birthday. Some fireworks shows are canceled, others are going on, which is great. Just watch them from, you know, if you want to, maybe with one other family. But it's not an excuse for huge parties with dozens or hundreds of people. I talked to the governors of Texas and Arizona yesterday. First of all, offering my solidarity with Texas and Arizona, offering to help them in any way that we can, and offering my personal and moral support to those two governors who are presiding over very difficult circumstances, but also in seeking their advice about the path forward in Colorado. And they really attributed their large-scale spikes to two main causes, private parties and bars and nightclubs. And so we'll talk a little bit more about bars and nightclubs later in this presentation today. But for private parties, it's really important that as we celebrate our nation's birthday, just do it with your family or with one other family. You can watch fireworks from a distance. and experience that this year. You know, maybe usually you went right up to the park and you did it. You know, growing up, I grew up in unincorporated Boulder County and a little bit in the hills there. And so we always, on 4th of July, we'd gather on our porch in my parents' house in North Boulder. And we would watch the fireworks at Folsom Field, and they were at some distance. And, you know, we didn't, a couple times I went to Folsom Field and got to see them up close, but largely we would, and so, you know what, rather than risk crowding and being with others and you never know what, you know, if the view's not as great this year, at least it's a different view. We're doing a lot of things differently in this pandemic. If you do go out, you know, set up your rug or your whatever you're sitting on, or your lawn chair seats, you know, make sure you're a good, you know, 10 feet apart from other groups and not in a crowded municipal park. We want to do this safe, and all of the different municipalities that are doing fireworks are encouraging that safety. They've hopefully gotten rid of any great areas where people congregate. We want to celebrate our nation's birthday, but we want to do it in a way that values life and values our economy. And I know that we can do that in Colorado. We were responsible generally on Memorial Day weekend. Both Arizona and Texas also reported a lot of large parties on Memorial Day weekend. We had some, and that led to some of the spike of infections in, I think, Boulder County and San Miguel County, if I'm not mistaken. I mean, you see it in the data right away. When people are having large parties, there's a spike. Because it goes from, instead of this R naught at close to 1, right? Normally, we keep our distance from others, we wear masks. You have one big party, it goes from 1 person to 43 people. I mean, that's what this virus does. There's a bar in Michigan where it went to 106 people, right? Must have likely started with 1. In environments and with the virus spreads, we cannot afford to give the virus that kind of leg up or advantage in Colorado. We're a few steps ahead. We need to keep it up. Thanks everybody for joining. We have very important information to discuss today on the path forward for Colorado. I'm excited to be joined by Jill Ryan, the Executive Director of the Colorado Department of Public Health and Environment, Dr. Rachel Herlihy, the state's top epidemiologist, Joni Reynolds from Gunnison County, she's the Public Health Director in Gunnison County, and Jason Volling, the City and County of Broomfield Public Health Director. We're also joined by the First Gentleman of Colorado, Marlon Reese, and I want to welcome him joining me in the first press of a conference that he's joined me in since the COVID crisis. You know, at the end of April, we talked about the 3 phases of managing the virus, living with the virus, and opening our economy, enjoying the Colorado we love. Stay-at-home phase, the safer-at-home phase, and the protect your neighbors phase. So we talked a little bit about protect your neighbors last week, but today we are now ready to kind of fill that in. We want to give you the specifics on what it takes for a county or a group of counties regionally to move into the protect our neighbors phase. So to be clear, we're not announcing today any automatic relaxing of regulation. There's nobody today that is protect our neighbors. We're putting forward the criteria, the framework that ties a community's ability to relax their guidelines and be empowered to do that, not have to come to the state for a variance, not have to lobby. Basically, the community itself can move forward with relaxing their guidelines when they demonstrate the ability to suppress and contain COVID-19 cases. We really want to empower our local communities to be able to protect their health and safely reopen their economy and return to a sustainable sense of normalcy. And that's protect your neighbors, gatherings up to 500, potential to increase capacity in restaurants from 50% higher. But again, we have to show that we have the capacity at that local level, because it's all about nipping outbreaks in the bud, getting them early before they become community-wide outbreaks with significant community transmission that requires additional public health steps. So we want our counties to be ready. Some will be ready in early July, some will be ready in late July, some will be ready in August. Today we're going to talk about the criteria of how they can get ready to do that. And these are the 3 levels: stay at home, safer at home, and protect our neighbors. About 3 months ago, we entered the safer at home. We were one of the first states to successfully transition out of stay at home to safer at home. And during this current phase, much of our economy, almost all of it, is being reopened. 25%, 50% capacity, physical capacity, just allowing for more distance, right? So if you've been to a restaurant, you've seen it. The tables are more reasonably safe environment. They're further apart. Outdoor dining has been embraced. If you go into a store, a grocery store, retail store, all the people in the store are wearing masks. We encourage you should wear a mask too, out of respect for them, and of course to keep yourself safe. Very important to wear a mask when you're around others. And then going forward, many areas of our state are going to be able to enter the Protect Our Neighbors phase, which is where we will be until there is a virus or cure. So in Protect Our Neighbors, we can find a way to do really everything we want to do. It's just with precautions, with guidelines, in a safe way, and a regional approach that allows for greater flexibility in areas that are successful in suppressing the virus, where local outbreaks are managed and detected early by a strong local health department. And that's really what this is about. Now, this has been science-based and methodical. Right now, we are in the middle of scaling up our public health infrastructure in Colorado. Getting this right is key to reopening our economy, and thus far, we have one of the lower unemployment rates among the states because we've been successful. We have to continue that. We don't want a setback. We don't want it because of its tragic human consequences. We've lost over 1,500 people to this. This virus would take another 1,500 from us in a heartbeat if we let up, or more. So we don't want it from a human perspective. We also don't want that as an economic setback for all of us, or just a setback in us being able to enjoy the Colorado we love. I mean, we have youth sports going on. My daughter's in a camp at Boulder Reservoir in a boat right now. She's doing paddle boating, and last week she did a clay camp. I mean, we want this stuff for our families and our kids, and that's why our diligence is so important. Because we can't take that for granted. There are many areas of the world and many areas of the United States where people aren't able to enjoy that kind of freedom and what they love about life because it is too dangerous. And we want to make sure that it stays reasonably safe in Colorado. I always use the word reasonably because if you want to stay safe, like my 76-year-old parents, they are staying at home, and they are being very careful about doing that, and they plan to continue that because they do not want to risk a virus that for people their age has a 1 in 3 chance of hospitalization. For younger people, the risk of hospitalization and fatality is less, but it is still far more severe than almost any other normal health condition like a flu or anything else that a young person could encounter. Even for people in their 20s, we're finding 1 in 15, 1 in 20 need hospitalization. So I mean, if you're a young person thinking of going to a big party over 4th of July, first of all, try to encourage your friends not to hold that big party, but just realize you're really rolling the dice. I mean, out of that party, out of your top 20 friends, 1 or 2 are going to need to be hospitalized for days or weeks, and hopefully they'll make it through it. Most of them will. Some of them might not, but it's no fun to be hospitalized and not be able to have any visitors. Your loved ones can't even visit. And you could be there for a week, 2 weeks, 3 weeks at the hospital. I mean, I've seen people go in, fit, muscular, healthy, come out gaunt and weak, many more weeks of recovery after the hospitalization. So you do not want this. Be careful, be smart, avoid parties, and celebrate our nation's birthday in a way that our founding fathers would have wanted us to, celebrating our freedom, celebrating our independence, and doing it in a way that protects our lives. Coloradans are doing their part. We're wearing our masks, and that's, again, I think we're breaking through finally on some of the other areas. People coming in from Arizona and Texas now to Colorado more likely to wear masks because they're doing it there. We're doing it here. Breaking through the ideological side. You have the vice president, politicians across the spectrum, all saying that this works. And of course, the science is even more clear now than it was a month ago, and certainly than it was 4 or 5 months ago. I can't stress enough that the fate of Colorado in both suppressing the virus and our economic recovery is largely in your capable hands. Our economic recovery is integrally connected to our ability to suppress the virus, and our ability to suppress the virus depends on individual choices that every Coloradan makes. If you wear a mask, if you keep your distance from others whenever possible, if you wash your hands frequently, then we will weather this storm together and continue forward on the path to prosperity and health. And I'm very proud that thanks to your hard work, we are doing better than our neighboring states on virus suppression and on economic recovery. The two are linked. Colorado's unemployment rate was more than 3 points below the national unemployment rate in the month of May. And we've already recovered 20% of the jobs that we lost in March and April. That's significantly higher than nationally, where our country's only recovered 11%. Now, we also know that an unemployment rate of 10.2% is unacceptable. Lower than the rest of the country, unacceptable in Colorado. And you know that unemployment rate is not just a statistic. It represents the pain and the struggle of tens of thousands of Coloradans worried about making their rent or putting food on the table. And my administration is committed to doing everything we can to help support these families and get everyone back to work. But it begins with effective management of the virus. And we've talked about the economic tools. Our legislature passed a $250 million fund, public-private partnership for loans for businesses, a $20 million recovery fund for grants for small businesses. We're grateful for the Paycheck Protection Program. We call upon Congress, and I'm confident that they will negotiate an additional package to help grow our economy. But in the meantime, the most important thing that we can do is effective management of the virus, the decisions that you make to protect yourself and protect your family. Look, and while Colorado's doing a good job so far relative to our neighbors, it doesn't mean we've been perfect. The incidence rate has been going up the last 2 weeks in Colorado. We're not a hot red color like some of the neighboring states, but we would rather be a cool white color. There's only 4 or 5 states that are. We want to be able to reverse that trend and keep the virus in abeyance. We've been successful so far, but we need to keep it up. And we have 2 major updates to share today. We're going to lay out how counties and regions of our state can enter protect our neighbors. And we also need to talk about how we rein in some of the unsafe behavior that has been occurring in bars in our state and nightclubs and has directly led to the crisis in Texas and Arizona. Now, what we're doing is we're essentially modifying the guidance for bars to go back to where we were 2 weeks ago. Now, look, in my eagerness to get Colorado reopened and back to a semblance of normalcy, our guidance on June 18th allowed bars and nightclubs to open at reduced capacity. I'm as excited. Look, I'm 45. I don't go out to bars, but I know they're important. Some people my age do. But I know that people in their 20s go out to bars. I went out to bars. I get, they're important. And they're important economically. People work at bars. It's an important way to get your frustrations out, socialize. But you know what? Our country and the world has not yet figured out, in a pandemic, how to do bars and nightclubs safely. We just haven't. I spoke to Governor Abbott in Texas yesterday. I spoke to Governor Ducey of Arizona yesterday. And as they've also said publicly, the bars and the nightclubs have been a major source of their outbreaks. And I think they wish that they had been able to act earlier and had the foresight. And we're gonna learn from this. In Arizona, they had to close gyms, pools, movie theaters. And I know the people of Colorado don't want to close gyms and pools and movie theaters, and I don't want us to close gyms and pools and movie theaters. And at this point, having bars and nightlife in an unsustainable way is simply too big a risk of a setback for Colorado. It's too big a risk. They've already delayed the school year in Texas. It's too big a risk of schools being too unsafe to return to. It's too big a risk of having to close gyms and pools. It's too big a risk of having to reduce restaurant capacity, as Texas also did. We want to go the other way. With Protect Our Neighbors, we could increase restaurant capacity across our state, building on the 50%, 60, 70%. We want to get to more restaurant capacity, not less. So, along with the rest of the world, we want to figure out bars and nightclubs. I have no moral approbations about bars and nightclubs. I went to them myself in my 20s, and, just as for some people, church is very important. For some people, outdoor recreation is very important. Whether you personally go to bars or not, just understand that they are important for many people in our state. They're an important part of their life. But there is not a way that we have found for them to be a reasonably safe part of people's lives during the month of July in our state. That doesn't mean that there won't be any bars or nightclubs that are open in our state in July. We expect that some areas will be able to get to the protect our neighbors phase and show that strong county capacity to get an outbreak early. And, whether it's the second week of July, third week of July, first week in August, I fully expect that many areas of our state will move forward with that. There are also some areas of our state that have variances because of very low virus count where it's reasonably safe to be in a bar-like environment, and those, of course, also remain in place. But we simply aren't ready to safely have the level of mixing and socializing that is inherent in a bar and nightclub environment. And by the way, many bar owners have done their best. Since they, opened June 18th, they've tried to have the social distancing guidelines in different groups. But you know what? What happens at bars and nightclubs is people go there for a couple purposes. One of those purposes is they tend to get inebriated. And the other purpose is they want to associate with others and meet others. They don't just want to go like in a restaurant setting and go with the 4 people they came with. They see their friend, they see their cousin, they socialize. And we want that to be reasonably safe. We want to get back there. We won't be there statewide in July. There's another reason as well. With neighboring states now closing bars, we don't want Colorado to become a mecca of nightlife in the pandemic. Amarillo, Texas is only 4.5 hours from Pueblo, 5 hours from Colorado Springs. We don't want areas where the virus is prevalent to have the demographic that it's prevalent in their 20s and 30s because their bars are closed, coming to our bars. Arizona borders Colorado. So we want to make sure that we don't stand out as the area where there is unsafe nightlife. When times are good, I want Colorado to be the center of nightlife. We want Denver, Colorado Springs, Pueblo, our great cities. We want them to be the center of nightlife. We welcome people from Texas and Arizona and New York and Florida, and we value our renowned nightlife here in Colorado. But that is not a distinction that we want during the pandemic, nor is it one that we can afford without severely risking the ongoing opening of our economy and the ongoing health of our people. We also need time to set up compliance efforts to suppress the virus before we continue. And as a nation, our state is no exception in not having yet figured out bar and nightclub environments that are reasonably safe during a pandemic. Look, Colorado is currently a positive outlier. We want to keep it that way so we can continue reopening rather than being forced backwards at great economic cost and, yes, great cost in human life. So that's why these higher risk bars and nightclubs will be able to open under the Protect Our Neighbors phase as we build on the progress we've made. And many of them also have been successful in adapting to restaurant formats, and they can continue to be open just as they were before June 18th. Bars that serve food that people are seated in. They come in with their group. They sit with them. That is reasonably safe, like a restaurant environment is. It's really the great degree of social mixing that I don't think anywhere they figured out how to separate from a bar or nightlife experience. But we are also doing our best, and we sympathize greatly with, of course, our small businesses. We're freeing up, making sure that bars can do takeout, sales of alcohol. We're paving the way for them to expand their footprint outside, just as we did for restaurants. 24-hour turnaround on liquor licenses for outdoor seating for the bars that are serving food. They can from a food truck or from their own kitchen. So we're reducing regulations, reducing red tape. Some will choose to operate in this way, some won't. But we want to provide that pathway forward because we value our nightlife, and we will celebrate the day again when Colorado will have renowned nightlife of regional, national, and indeed international acclaim. Look, it makes sense that communities with low transmission rates and strong public health capacity should be able to reopen more and faster, and that's what Protect Our Neighbors is all about. The same way it makes sense that we were one of the first states to allow variances by counties, because counties with low virus counts shouldn't have to play by the same overly protective rules as areas with widespread community transmission. We also want to make sure that we institutionalize and provide greater local flexibility, including for opening bars and nightclubs, but also for sporting events, for large graduations, for county fairs, for all of these things that are an important part of the Colorado way of life that make life worth living. And scaling up our public health capacity is the way that we can be effective in this strategy to contain the virus at the site in as localized a way as possible, ideally at the individual level. And if not that, at least at the site-specific level, whether it's a workplace or a store or a restaurant. And that's why we are making much-needed investment in our local public health agencies so they can quell an outbreak before it gets out of control. Think about this like a wildfire. And by the way, this is wildfire season, so be careful over July 4th weekend. The last thing we need to tax our already challenged first responders are an outbreak of fires across our state under the drought conditions that are already encompassing large parts of our state. But today we're going to give you the specifics on what it takes for a county to move into the protect our neighbors phase. And that's the phase where we exist with the virus until there's a vaccine or cure, and where we have the maximum freedom, full economic activity, almost full social activity, including sporting, bars, nightclubs, really up to 500 people initially, and even the pathway to grow beyond that in a reasonably safe way. And to be clear, again, we're not announcing any relaxing of restrictions that occurs automatically today. This is the framework. Some counties and regions will be ready in early July, some in late July, some in early August. It all depends on where the virus is and where they are. And that's the way it should be. That's just common sense. Our goal is to contain the virus at the individual level through contact testing and tracing, site-specific level, effective interventions where there's an outbreak, could be at work, place of worship, school, or community level if it reaches that point, if the other efforts fail. Scaling up our public health capacity is the best way to do that, the best way to be effective in nations that have handled this successfully, strong public health effort. I also think it's one of the secrets of our success to date in our home state of Colorado. Look, when I spoke to Governor Abbott and Governor Ducey the other day, they really conveyed the gravity of the situation in some of our nearby states, and we want to avoid that kind of crisis here. Look, the underlying premise of Protect Your Neighbors is that in order to reopen to the greater extent, we need to have really three things. Low virus prevalence, and that might mean low prevalence or a trend in the right direction. Healthcare capacity to handle a surge, the beds in the hospital, and then strong public health capacity to contain outbreaks and surges locally, including testing, tracking, and tracing. And this introduction of the new phase means different parts of the state will be ready for Protect Our Neighbors at different times. And that's reasonable in a big, diverse state like the state of Colorado, as approach has been flexible from the start with the variance process. This additional flexibility is important because if a local public health agency can scale its ability to do things right, testing, site closures, case investigation, contact tracing, then they are the first line of defense instead of having to control the virus through difficult closures and other limitations. So I want to make one final point before I introduce Jill Ryan. Strong public health systems plus additional healthcare capacity are the key to reopening the economy and enjoying the Colorado we love during the pandemic. And if we fail to manage this crisis well, then not only is there the need for additional local restrictions, but frankly, consumer confidence would suffer. If going to the store or restaurants were to become dangerous instead of reasonably safe, people wouldn't go. It wouldn't matter whether they were open or closed. Consumer confidence would be shot. Going forward, our ongoing economic success is tied directly to how well we control this virus, especially at the local level. I'm now proud to turn this over to Jill Ryan, the head of the Colorado Department of Public Health and Environment, to help introduce the Protect Our Neighbors phase.
Thank you, Governor. Over the past few months, we have been responding to a virus that has tested our state in new ways, and I want to compliment the team at the Colorado Department of Public Health and Environment and our public health partners at the local level who have risen to the challenge. This is a once-in-a-generation public health crisis, but each day we make progress to build the capacity of our public health system. In the beginning, our state lab had the capacity to process just 160 tests per day. Last week, we were able to process more than 8,500 tests between our state lab and commercial partners in one day. Across the state, we've ramped up testing. With support from the state, local communities have stood up 50 testing sites, meeting people where they are. And our private partners have helped expand access to testing as well. Increased testing has helped us track the spread of the virus and isolate those who have tested positive. When our state faced supply shortages, the Innovative Response Team identified creative ways to procure PPE from the private sector. Nearly 2.5 million N95 and surgical masks have been distributed to local communities. We now have a backup supply for the fall in case supply chains are interrupted again. Our hospitals have nationally recognized and celebrated coordination and are diligent about reporting and monitoring their capacity and PPE supplies so we can ensure our healthcare system is not overwhelmed. Thanks to Coloradans' commitment to following public health orders, we have not yet had to operationalize our alternative care sites. We hope we will never need to, but we'll continue to plan for the worst and strive for the best. We are hiring historic numbers for our COVID response workforce. This includes contact tracing, isolation support, resource navigation, and we expect to have nearly 1,000 new people hired at the department by the end of the summer. Now, those are just a few ways that we've grown stronger. I'm proud of my team who have stood strong during this difficult time, and I'm grateful to our local public health partners who are leading the fight against COVID in their communities. I'm proud of our progress, but it is important that we do not let up now. The virus is still prevalent in our communities, and every Coloradan must renew their commitment to keep the virus in check so we don't overwhelm our healthcare capacity and unnecessarily put lives at risk. Personal responsibility will continue to be the most important factor as we continue to move forward. Today, we are sharing the framework, Protect Our Neighbors. This is the third stage of our reopening. Stay at home, safer at home, and protect our neighbors. Each level allows for more economic and social activity depending on how the disease is spreading in specific communities. Moving forward, counties or regions that hit certain metrics can qualify for Protect Our Neighbors based on objective scientific criteria. If they qualify, they can move to a phase where they have greater local control over reopening plans. Now, the underlying premise of Protect Our Neighbors is that if we want to reopen further, we need to make sure we have strong public health systems built. That's why we have some amazing local public health agency heads here today to talk about what that means. But that's so important. If we reopen without the systems to handle increased cases or outbreaks, we will become overwhelmed and end up at stay at home again. Nobody wants that socially, economically, and education-wise for our kids. But if we open strategically, based on evidence and science, we can move forward in a sustainable way and, most importantly, save lives. And the way we do that is through empowering our local public health agencies. That's the key. Strong public health agencies is the key to reopening the economy. Protect Our Neighbors is a deliberate approach that empowers local governments, public health agencies, and partners to meet the needs of their communities by recognizing that local conditions in Colorado communities may vary. And Protect Our Neighbors isn't just words. It means we all accept personal responsibility for the things we do every day to keep ourselves and others healthy. So today we are announcing the scientific metrics that were developed through a state and local collaborative process. Next week, we will open up the certification process for counties that meet these metrics. In other words, nobody can move to Protect Our Neighbors today, but starting next week, if a county or region meets these scientific metrics, they can start the process of qualifying. I share the hopes of the governor and everyone in this state that we can continue to manage this virus and respond to both the public health and economic challenges that we face. Thank you.
Thank you. And I want to introduce Dr. Rachel Herlihy. You've heard from her before. She's our state's top epidemiologist, doing an amazing job, an important and valuable scientific advisor. during this crisis. She's going to talk about the science behind the framework. I also want to thank all of our local public health authorities. We have a few here you're going to hear from in a moment. Dr. Herlihy will introduce them. But I just, and I've been on some calls with all of you, but I just want to express our gratitude that people entered this career. You went into public health for a reason. You hope there would never be a situation like this, but there is. And this is the moment, and your moment, and the moment of our local public health agencies to make a big difference for our state. We turn to you to lead. We turn to you to lead on saving lives. We turn to you to lead on helping protect us against outbreaks so that we continue with being able to put food on our table for Colorado families. And I'll turn it over to Dr. Rachel Herlihy.
Thank you, Governor. As you mentioned, we want to give communities time to plan and assess and get community-wide support before they consider protect our neighbors. Regardless of the level that a community is at, there are things that will remain constant. People who have symptoms of COVID-19 or test positive must isolate as soon as their symptoms start. And people who think they have been exposed should get tested and quarantine. Additionally, under all levels, people should take preventive actions to limit their risk of getting and spreading COVID-19. Wear a mask in public, wash your hands frequently, social distance, and consider the risk of activities you choose to participate in. Starting next week, communities can request to qualify and be certified to move to the Protect Our Neighbors level. A county may seek to qualify by themselves or form a region with neighboring counties and submit for a certification together if they meet the scientific metrics. To qualify for Protect Our Neighbors, communities need to take 2 steps. They need to meet a set of qualifications, and they need to put forth a mitigation plan. First, they need to meet certain scientific metrics that indicate they have sufficient hospital bed capacity, sufficient PPE supply, stable or declining cases of COVID-19 hospitalizations, fewer COVID-19 cases, sufficient testing capacity, the ability to implement case investigation and contact tracing protocols, documented surge capacity plans for case investigation and contact tracing, and strategies to offer testing to close contacts of outbreak-associated cases. The exact numbers to meet metrics will be different for each county based on their given population. These metrics were drafted by a work group consisting of epidemiologists and public health experts from CDPHE, the University of Colorado School of Public Health, and local public health agencies from across the state. The group included representatives from urban, suburban, rural, and frontier counties to make sure we are taking into account geographic diversity. The second thing counties must do is to submit a mitigation and containment plan on what the county or region will do if they fall out of compliance with any of the metrics. This plan should include considerations on how they will promote social distancing strategies, increase mask wearing in public settings, and increase flu vaccine uptake. This is a dynamic, fluid situation. Counties, just like individual Coloradans, must continue to be vigilant if we're going to defeat this virus. These plans must be approved by local elected leaders, including county commissioners and mayors, the hospitals that serve the county, law enforcement, emergency management, the local public health directors, and if applicable, tribes. This is a bold step forward that relies increasingly on individuals and counties taking on more responsibility. We need to continue to take this virus seriously if we are going to be successful. The governor announced the closure of bars today. This is an important step. I've been in touch with my counterparts in Arizona and Texas, and we share their concerns about the level of risk associated with transmission of this virus in the setting of bars and nightclubs. We know that those risks, that those environments, bar and nightclub environments, result in individuals congregating. We know that one of the features of nightclubs and bars is often loud music, and because of that, individuals tend to be crowded close together and might talk more loudly, and that forced expiration is actually an increased way of potentially transmitting this virus. So with that, I applaud the governor's decision to move forward with closing bars in the state. We think that's an important strategy to protect Coloradans. And with that, I will turn it back over to the governor. Thank you.
Thank you, Dr. Hurley. We always wish that I always say I wish that I knew today what I'm going to know in 2 weeks about this virus. It's always tomorrow's information in 2 weeks. I wish that we knew what we knew today about the experience of Arizona and Texas 2 or 3 weeks ago when we were moving forward with at least limited bars and nightclubs. What they have found in those states, it is just very difficult, if not impossible, and no one has figured out the way to have safe social distancing in a bar and nightclub environment, partially for the reasons Dr. Hurley said. I mean, if you've been to them, yeah, you're yelling back and forth to people. You're there to meet other people. We'll figure out a way. There's got to be a way. Obviously, when areas are able to be and protect our neighbors, they have a good grasp on the virus, and they can certainly move forward with many kinds of activities, football games with fans at the high school and bars and many other activities. But we have to make sure that they are ready first. We are lucky in Colorado to have a great partnership with local public health leaders, county and inter-county. And I want to give a loud and a clear thank you to our local public health directors for their steady hands, their knowledge, their expertise during this crisis. Our state is stronger because of you. These local leaders help develop the Protect Our Neighbors framework and the metrics, and the plan is better for their input. I'm happy to introduce two of our amazing public health local leaders here today, Joni Reynolds, the Gunnison County Public Health Director, and Jason Volling, the City and County of Broomfield Public Health Director.
Thank you, Governor. And first of all, I want to say I really appreciate the leadership we've received from the Governor's Office and from the Colorado Department of Public Health and Environment. I appreciate the accolades we got from the Governor, but I want to echo that goes back to the leadership we've been receiving from you and also from our state health department. One thing that's become evident through this pandemic is we are all one public health system. And as diverse as we all are as local public health agencies, we need to think about how we address this from a systematic perspective. I'm not only here representing the City and County of Broomfield, I'm also representing the Colorado Local Public Health Association, which represents 53 local public health agencies across the state. We as local public health agency directors are the first line of defense to contain outbreaks, as was mentioned. Colorado's state and local public health agencies create the foundation for health that pays through thriving communities, environments, and economies. When there's an outbreak, and we've had these before in local public health agencies, such as mumps, norovirus, or measles, we are the ones that handle the response. And although we are facing an unprecedented crisis, the same principles of public health apply. Our core work is to contain and control the spread of the disease, which includes conducting disease investigations, testing individuals who are sick, finding out who may have been exposed to someone who is sick, that's also known as contact tracing, and disease control, including making sure those people who are sick can stay home and making sure others don't get exposed to people who are sick. These are, again, the key principles that we apply in public health when it comes to any disease control outbreak. I really want to thank the Colorado Department of Public Health and Environment, and specifically Dr. Hurley, for inviting us to be part of the committee to develop the scientific metrics that qualify a county or region to be eligible to enter in to protect our neighbor. While there are just two of us here today, there were 6 other local public health agency directors and numerous stakeholders, including epidemiologists, along with academia, that helped develop these indicators. And these directors were from Chaffee County, El Paso County, Eagle County, Lincoln County, Prowers in Kiowa County, and Pitkin counties. Again, that just demonstrates the diversity of thought that came into this process and led to probably some of the best outcomes we could have based on that diversity of thought. And as I mentioned before, we had epidemiologists that really provide that scientific expertise from numerous local public health agencies across the state, truly representing what's happening on the ground and the whole of our statewide efforts. With that, I want to turn it over to my colleague, Joni Reynolds, to talk further about the process. Joni.
Thank you, Jason. Thank you, Governor. I appreciate the opportunity to be here from Gunnison, Colorado, one of the most beautiful valleys in the state, where we really love the outdoors. We started early in this outbreak with early cases and an early response. We are proud to be part of a large public health system that partners with the state, the University School of Public Health, and all of the local public health agency colleagues around the state. This is an exciting, important step as we move forward in strengthening our public health system. But we know that strong systems are really only work when individuals also take actions to protect themselves and while their neighbors also. Local public health agencies have been working alongside their communities with their critical partners, their elected officials, their residents, places of worship, schools, universities, businesses, nonprofits, their healthcare system, to really develop responses in a community effort. Individual actions in this effort, such as physical distancing, wearing masks, avoiding crowds, washing hands, and staying home if you're sick, getting tested, and following the guidance provided from public health will all add up to a better control of this COVID-19 virus and a return to the Colorado life that we all value so much. This is especially as important this holiday weekend. We all want to move forward, and protect our neighbors phase allows us to move to another important step. But as everyone has discussed, this really depends on us being able to control this virus. So taking the extra responsibility, all of us, this weekend, to really look out for each other, follow the guidelines, so that we can move forward together in a more and more sustainable pace as we fight this virus, a once-in-a-generation virus. I really want to thank Executive Director Hunsicker Ryan. Without her leadership for our public health system, I can't imagine the challenges we would be facing, and I feel the support throughout the state because of her leadership. I also really want to thank Dr. Herlihy for her collegial outreach and for her effective leadership of the group that really put together the metrics as a group of colleagues working for one collective outcome. And finally, I want to thank Governor Polis for all of his leadership for our entire state. Thank you.
Thank you, Director Reynolds, Director Valling. Now, I know that we're asking a lot from our local public health agencies, and I want to make sure that any folks that are listening to this, including commissioners or other public health agencies, know that yes, the state will help you get there. The state will provide funding to help you achieve these benchmarks. There's significant federal and state support that is going out the door to help get you at the county level ready to be able to further open your economy as quickly as is reasonably safe. In total, the state is investing $346 million in state and local capacity, $75 million going directly from the state to local public health agencies. In addition to that funding commitment, we're making additional funding available to the critical system strengthening work. Local public health agencies can get a planning grant of up to $50,000 to help community partners and community engagement efforts to get ready for the next step. Also, many public health agencies that are already there and have identified infrastructure needs, engaged with impacted communities, can go for grants of up to $300,000 with a local match that would be spent on technology, community resource coordination, community activities to increase compliance with public health orders, mask wearing campaigns, and funding for community-based partners. So The state wants to help you open as soon as you can in a reasonably safe way. It's not just saying, here's what you have to do to get to protect our neighbors. We're saying we want to help you get there as quickly as you can so that we can get back to the Colorado that we love. Our existing investment and our new investments combined will help dramatically expand testing, contact tracing, and containment across the state, which is critical to allow counties to enter the protect our neighbors phase and us to really get back to the Colorado that we love in a reasonably safe way. Our ongoing economic success is tied to how well we control this virus. One of the reasons that we're doing better economically than other states is because we are doing better at controlling the virus, and we need to keep it up. We need to make sure that we avoid large parties and get-togethers over July 4th weekend. We need to wear our masks in public, be 6 feet from others whenever we can. And I know that we need to do our part. For those of you that are traveling across the state, be safe, be smart, have fun. Whether you're enjoying Colorado's great, vast outdoors, going camping with your family, whether you're celebrating at a cookout with just your family, maybe one other family, hopefully not more than that. Don't forget to take the steps that we can to keep one another and our communities safe. Avoid risky activities, use common sense. It's interactions with people and physical proximity that give this virus the opportunity to spread, and we want to deny the virus that opportunity in our state. Here's a few suggestions for Coloradans. Make it safer. If you want to participate in in-person activities, keep it small. Keep your distance from others. Wash your hands regularly. Smaller gathering, your family, one other family, keep it small. Stay outside. Transmission of the virus is less outside. And don't be afraid to speak up or change your plans if you feel uncomfortable about the risk level, especially for those in their 60s, 70s, and 80s. Know before you go, check fire bans, check COVID local related rules. Remember, in your area, wearing a mask might be common sense. In another area of our state, there might be a fine for not wearing it. Please honor the local restrictions. Just because we're in the middle of a pandemic doesn't mean we can ignore other safety rules, like fire safety rules, that keep us all safety. And yes, it is fire season, and we need to be more careful than ever before because of the added threat of COVID-19. So we want to prevent situations where people have to evacuate their homes and firefighters have to deploy to camps, resulting smoke that worsens air quality. All this is very bad in the middle of a pandemic. So consider, skipping fireworks or doing them in as safe a way as possible this year if you're doing your own. And there's many campfire bans in effect depending on where you are in our state. Be smart, be careful. Let's prevent large fires in our state. Together, we can help slow the spread of this virus and preserve our progress in the great, vast outdoors where we love to play. I wish everyone a safe, happy, and healthy 4th of July weekend. Let's make sure we celebrate our nation's independence in a safe way. Thank you, and we'll open it up to questions. Yes.
Provide some more details on the bar closure. When does it go into effect? How long? What about counties that have variances? Does it affect breweries? And I know you talked about other states, but I'm curious if we saw a spike here related to bars and nightclubs.
So we have seen an uptick, and it likely relates from a couple of causes. Our uptick, like the major spikes in other states, is largely among a younger demographic. And I think it is partially attributable to the bars and nightclubs, and also potentially to the large public gatherings and the protest movements that we've seen outside. So those are two factors that we've had in our state. Thus far, it's just a small uptick, but I think that we can nip this in the bud by acting soon. Variances that have been granted are still in effect, and this will go into effect tomorrow, or in the next, I would say in the next 48 hours, the public health order is forthcoming that spells out all those details. And it's a 30 to 30 days. I expect that some areas will successfully enter Protect Our Neighbors before 30 days. And along with many other activities, bars would be included in that if the local jurisdiction chooses. But we would be devolving that authority to counties and multi-county groups that have the capacity to contain outbreaks at the site level. Next question. Oh, phone question.
Yeah, Governor Polis, thank you.
Can't hear you.
It's David Kluo at Denver 7. Last week, you got involved in the Elijah McClain case by asking the Attorney General to open an independent investigation. We know there's a question mark on the officer's conduct that night. This week, we learned there's photographic evidence that 3 other Aurora officers made fun of the case, made fun of the chokehold, made fun of Elijah's death. And that photo was distributed around the police department in Aurora. What is your response to this?
Well, I would say the scope of the independent investigation will include any potential violations of state law that were by the officers involved, the paramedics involved, or other officers if there was a criminal cover-up. The Attorney General will be diligently at work in the coming weeks and months in that investigation that will pursue all leads.
So, Governor, question on testing. What's preventing us from reaching higher numbers of testing? The Harvard Global Health folks say a state like ours should be up at like 13,000 for mitigation. I think we're hitting tops 8,500. Is it due to supplies? Is it due to enough people showing up that want to be tested? What's preventing us from being higher?
So we have a milestone. We have 50 free community testing sites across our state. It's been gradually going up in the last few weeks. Pepsi Center, one of the major ones in the Denver metro area, had a single day yesterday, or it was 2 days ago, when they tested over 2,000 people. Great milestone for the Pepsi Center. All free, all easy, all quick. Anybody who wants to get tested can get a free, quick, and easy test at a community testing center or at their provider. Many people have a relationship with their own doctor. You can get a test there, local hospital. But we also have 50 free community testing sites. And anybody who's symptomatic, if you have even minor cold symptoms, headache, fever, get tested. Get tested. And then in addition, many who don't have symptoms, just if you are exposed to others, if you work in retail, if you think you might have been exposed, if you're just concerned, please get tested as well. Our positivity rate has been maintaining in that sort of 3 to 4% range. We haven't seen the major upticks. In Arizona and Texas, they're in the 12, 14% range in their testing. We're down at about 3 or 4. We'd like to keep it that way. And if people behave safely and smartly over July 4th weekend, hopefully we will. But yeah, testing is widely available, and anybody with symptoms can be tested.
This is Mark Mata with the World Journal newspaper. A 2018 report commissioned by the Colorado Tourism Board shows that the top urban areas that send overnight vacationers to Colorado include Dallas, Fort Worth, Houston, Phoenix, Salt Lake City, Kansas City, Los Angeles, and Miami, Fort Lauderdale, which are all places that are seeing spikes in COVID right now. With summer tourism season approaching its peak, are you considering any measures such as New York's quarantine of visitors from known out-of-state hotspots?
So first of all, I think most Coloradans are smart. They know this. Don't travel to a hotspot. If you had a vacation plan in an area that has an enormous spike, probably you should delay your trip, right? Common sense. We have many tourists from states that have higher infection rates, and we want to make sure that they are responsible in our state. If mask wearing wasn't part of what they did where they came from, even though it increasingly is, you wear masks in Colorado. What we're telling folks in who work in our tourism communities, in stores and in restaurants, is you should treat every customer like they are contagious with COVID, because some will be, and they might not even know it. And that tourist or customer might be from Denver, they might be from Aurora, they might be from Tallahassee, they might be from Phoenix, but no matter where they're from, take the precautions. Every waiter, everybody in a store is wearing a mask for safety, avoiding physical contact, washing their hands regularly, and respecting physical distancing. It doesn't matter where somebody is from, whether they're contagious. What matters is that in all interactions, we are taking every precaution we can to avoid transmission.
Hi, Governor. This is Joe Vaccarelli with Denver 7. Just circling back to the Aurora Police Department and what they're dealing with the Elijah McClain case and the 3 officers on leave today. What is your sense of what Aurora Police needs to be doing right now to regain the public trust?
Well, law enforcement can only be effective when there is great community and public trust in their work. When that trust is breached, crimes aren't reported. Cooperating witnesses don't cooperate. it's harder for investigations to succeed in catching criminals and bringing them to justice. So every law enforcement agency in our state should really make sure that they work to develop strong relationships with the communities that they serve, including marginalized communities, communities of color, and immigrant communities. In a huge, diverse community like Aurora, that's even more important, that law enforcement agencies, including Aurora PD, work very hard in developing deep relationships of trust with those who they police, including in immigrant communities and communities of color. Is there another on the phone? If not,
Hello, Governor.
Oh, yes, go ahead.
Okay, I'm Jesús from Noticias Univisión. Gobernador, ¿cómo funcionará el proceso de perdón de condenas por los crímenes relacionados con marihuana y por qué apoya esta medida luego de que fue aprobada en último momento en sesión legislativa?
Estoy muy contento que pasamos y firmé una ley nueva que da la oportunidad para ofrecer perdones a toda la gente quien tiene una ofensa de marihuana en su historia. Este puede empezar en unos 90 días y estamos haciendo la procesa para dar perdones a personas quien tuvieron menos que 2 ounces de marihuana cuando era contra de ley. Por ejemplo, en los años 90 y 80, 1994, antes de la cambio de ley, y este puede aparecer en 90 días. Okay, thank you so much for your questions, and we'll have another update next week. We're going to focus on testing and tracing. We're going to go in depth in the work with public health, with state health, on testing and tracing, and the scale up in that regard. Thank you.